Canadians have long prided themselves on the country's universal healthcare system. For decades, in survey after survey, Canadians said their healthcare system, which offers everyone access regardless of their income or circumstances, was the #1 thing that made Canada a great country. Maybe more than anything else, it was what distinguished Canada from America, where private healthcare dominates and where the quality of care often depends on how much money you have. In a poll carried out 10 years ago, 94% of Canadians pointed to the healthcare system as the thing they were most proud of about their country. Canada's universal healthcare was the one thing that pretty much all Canadians agreed on. It was a major force unifying the country. But now Canada's healthcare is facing collapse, and that's not just rhetoric. Those are the words used by the president of the Canadian Medical Association to describe what's happening to the healthcare system. Wait times for treatment and surgery are the longest they've ever been. People are dying waiting for care. Burned out doctors and nurses are quitting. Emergency rooms are shutting their doors on weekends and at night, and the experts say things are only going to get worse if serious reforms don't happen soon. In this video, we're going to look at 3 elements of this problem: what's happening with the Canadian healthcare system, why it's happening, and what we can do about it. The first thing to understand about Canadian healthcare is that it is deteriorating rapidly. Waiting times for surgeries and treatments have soared in recent years after growing slowly for decades, and this is causing premature deaths. According to estimates from research group Second Street, 53,000 Canadians have died while waiting for treatment since 2018. That's more than 1 out of every 1,000 Canadians. If Canadians were dying at this rate from homicides or terrorism, everyone would agree this is a national emergency. And yet when it happens quietly with people at home waiting to see a specialist or a surgeon, our politicians stay silent and the media only mentions it from time to time. In just the past 3 years, the amount of time Canadians spent waiting for treatment has grown by an average of 5 weeks. And over the past 30 years, waiting times have tripled, from an average of 9.3 weeks in 1993 to 27.4 weeks today. Right now, there are 2.9 million people waiting for healthcare in Canada. That's 1 out of every 14 people in the country. And it's not just life-saving treatment. For many people in many parts of the country, finding a family doctor has become impossible. A recent survey from the Our Care Project found that 22% of Canadians, or more than 1 in 5, don't have a primary care provider they can see to deal with health problems. That's making things much worse. When people don't have a family doctor, they tend to let their healthcare problems get worse until those problems are very serious. By the time they're seen in an emergency room or walk-in clinic, it may be too late. Not only does this cause unnecessary deaths, but it also increases costs to the healthcare system. The sooner a problem is discovered, generally the less expensive it is to treat. With no family doctor to visit, many Canadians rely on walk-in clinics for care, but even these walk-in clinics can no longer handle the volume of patients they're seeing. Even at a walk-in clinic, you may have to wait a long time to see a doctor. And so Canadians instead are using emergency rooms as their family doctor, and that's putting serious pressure on emergency rooms at a time when doctors and nurses are leaving their jobs. Wait times in emergency rooms have soared, and many frustrated patients are leaving without even having been seen by a doctor. Today in Canada, we're seeing emergency rooms shutting their doors due to a lack of staff, especially in rural areas and small towns. Many emergency rooms are now shut for the weekend or close their doors in the evening. In Ontario alone in 2022, there were 145 emergency room closures, and the evidence suggests things are even worse this year. This too is putting people's lives at risk. In many parts of the country, people now have to travel for more than an hour to find emergency care because their local ERs are closed. Imagine what that means for the survival rate for people who have been in an accident or suffered a heart attack. The results are clear. Life expectancy in Canada is falling. Canadian life expectancy peaked in 2019 at 82.03 years. Since then, it's fallen in almost every province every year. In British Columbia, life expectancy for men has fallen by half a year, back to the levels it was at a decade ago. And in Saskatchewan, life expectancy has fallen back to where it was in 2000, more than 20 years ago. Some of this can be blamed on the COVID pandemic, and many point the finger at the fentanyl drug crisis as being the cause. Those factors have played a role, but few people want to admit the whole truth, that Canadians are now dying preventable deaths thanks to a healthcare system that simply isn't there for them. And on top of all that, a new issue has come into the spotlight: Canada's system of medically assisted euthanasia. In recent years, Canada has passed a set of new laws known as medical assistance in dying, or MAID for short. This was not just the result of a policy goal from Justin Trudeau's Liberal Party. Rather, it was imposed on the country by a Supreme Court ruling, which which stated that all Canadians have a right to die with dignity. Many argue this was an act of judicial activism that has sent Canada's healthcare system in the wrong direction. Stories have exploded in the media about Canadians who have chosen to end their lives rather than suffer with pain while waiting for treatment. And worse yet are the stories where Canadians who are suffering, including those suffering with mental problems, have had euthanasia suggested to them as an option. Many observers inside and outside Canada have been shocked by these headlines, so it's hardly surprising that a new conspiracy theory has emerged that Canada is engaged in a grand experiment with eugenics, where the healthcare system is used to kill the sick and the old rather than helping them. With everything going on in the healthcare system, can you blame people for believing this? So why is all this happening? Why has the healthcare system gone from being a source of pride for Canadians to being so bad it's a literal danger to people's lives? Many blame the COVID-19 pandemic, pointing to the stress that the pandemic put on the system, but that's not the cause of the problem. The dysfunction began long before that. If anything, the pandemic exposed the problems that already existed in the healthcare system, and since the pandemic subsided, things have not improved in healthcare. They've only continued to get worse. Some say it's a lack of funding. The political leaders of Canada's provinces and territories, which are responsible for delivering healthcare, are constantly going hand in hand to the federal government, asking for more money for the healthcare system. But money isn't actually the problem. Canada actually has some of the highest spending on healthcare per person in the world, the 8th highest in the world, in fact. But what does seem to be the case is that Canada's healthcare money is being wasted. Canada has a massive healthcare bureaucracy, and it only grows larger by the day. Each of Canada's 13 provinces and territories has its own healthcare system, and within those systems are countless regional health authorities, each with their own bureaucracies and their own executives, making hundreds of thousands of dollars per year. The money that other countries use on doctors and nurses gets used to pay for bureaucracy in Canada. And the results are clear. In the 1970s, Canada had among the highest doctor-to-population ratios in the developed world. Today, it has among the lowest. Canada has 2.46 doctors for every 1,000 people, compared to 3.4 doctors on average among the OECD countries. Countries like Hungary, Slovenia, and Estonia have more doctors per capita than Canada does. Austria and Norway have twice as many doctors per capita as Canada. But wasted money isn't the only problem. Canada has also completely failed to prepare for its aging population. Like other Western countries, Canada has a low birth rate, meaning that as time goes on, a larger and larger share of the Canadian population are seniors. In 2010, 14% of Canada's population was age 65 and older. By 2022, this rose to 19%, and by 2030, it's expected to be 22.5%, or nearly a quarter of Canada's population. The number of seniors in Canada is set to grow five-fold over 50 years, from around 2 million seniors in the late 1970s to more than 10 million seniors by the 2030s. Not surprisingly, senior citizens are the biggest users of the healthcare system. This explosion of old people is putting enormous strain on the healthcare system. This is a problem that Western countries have known about for 40 or 50 years at this point, and while other countries have prepared their healthcare systems for this, Canada has not. So what can Canada do about this? Can we actually fix the problems with our healthcare system? To answer that question, we can look at a country that many Canadians admire, Sweden. A generation ago, Sweden's healthcare system was on the brink of collapse, not unlike Canada's today. Then the country began to implement major reforms. Sweden shifted from a government-provided healthcare model to a mixed system where public and private healthcare coexist side by side. Sweden has public hospitals and clinics, and private ones as well. At the same time, the government passed a Patients' Bill of Rights, which stated that all Swedish residents have a right to healthcare within a certain amount of time. If a Swedish person doesn't get treatment at a public facility within the allotted amount of time, they can go to a private hospital and get treatment, and the government has to pay for it. In other words, Sweden created a system of competition for healthcare providers. And because paying for treatment at a private hospital is around 30% more expensive than treatment at a public hospital, the government had lots of incentive to make public hospitals more efficient. Today, Sweden has one of the best healthcare systems in the world. In terms of outcomes, it consistently ranks in the top 5 worldwide. Could such a system work in Canada? Almost certainly, but the political obstacles to these changes are huge. For one thing, Canada has a law called the Canada Health Act, passed in 1984, which severely restricts private healthcare. Creating a system of private hospitals would mean undoing or rewriting this law, and that would almost certainly be a major political problem for any government. Many Canadians are simply opposed to allowing private healthcare facilities to to exist. This comes from a fear that if Canada were to allow for-profit healthcare, the country would end up with a US-style system where access depends on how much money you have. But of course, that's not the system that Sweden created. Yet politicians, especially on the left, will fearmonger about this in order to win political points, and that will make reform extremely difficult. The irony of it is that today, Canadians are so unhappy with their public healthcare system that they are less satisfied with access to healthcare than Americans are. Whether they realize it or not, Canadians would actually be happier with America's unfair for-profit system than they are with their own supposedly fair and equal system. But with Canada's system failing so completely and so quickly, opposition to private delivery of healthcare is beginning to erode. A recent survey from Ipsos found that 59% of Canadians now support some version of private delivery of public healthcare. In other words, something similar to the Swedish system. Quebecers were the most open to this kind of system, with 75% saying they would support some amount of private healthcare delivery. All of which is good news because, at the very least, it shows Canadians have realized that the current system can no longer continue. The long wait times and the lack of access to doctors have finally convinced the public that major change is needed. Of course, healthcare isn't the only place where taxpayer money is being wasted in Canada. To learn more about that, check out our recent video on how the government of Canada is wasting your money. And if this video brought value to you, please consider liking and subscribing. Thanks for watching.